Welcome back, everyone, to part one of this training explainer. Ever wonder exactly where a medical code goes once a procedure wraps up? Well, I can assure you it doesn't just disappear into the ether. Today, we are going to build a rock-solid, foundational understanding of how healthcare reimbursement actually operates. We're going to map out exactly where the work you do ends up, and more importantly, who hands over the money for it.
Here is our roadmap for today's explainer. We'll quickly cover healthcare payer categories, the universal claim filing mandate, commercial insurance dominance, defining commercial carriers, and then wrap up with a summary and next steps.
Let's jump right into Section 1, Healthcare Payer Categories.
So what exactly is a payer? Basically, payers are the entities responsible for providing reimbursement to healthcare service providers. Think of a payer as the ultimate financial destination for all your coding efforts. They are the crucial link between the services a doctor or hospital provides and the actual revenue that keeps those clinic doors open. Without the payer, the whole system just grinds to a halt.
Now we can drop these payers into three main buckets. First up, commercial payers. Those are your private insurance companies. Second, government payers, which means massive programs like Medicare, Medicaid, and TRICARE. And third, third-party administrators, or TPAs. You are definitely going to need some serious coding agility to track these three categories, because they completely dictate who pays you, how much they owe, and exactly when that reimbursement is due.
Moving down the funnel, Section 2, the Universal Claim Filing Mandate.
Here is the absolute golden rule of billing. Every single interaction between a provider and a patient must be reported as a claim to the payer, regardless of who that payer is. This is the universal mandate. You literally need absolute operational discipline here, because every encounter, no matter how tiny, has to be formally reported. There are zero exceptions based on who's footing the bill.
And you have to file these claims with absolute accuracy and lightning speed. It's an operational necessity. Why? Because it's the only way to track financial accountability effectively within the healthcare system. You need to know, at a glance, who is supposed to pay you, how much they're supposed to pay, and when to expect it. If you lose speed or accuracy, that whole financial tracking system just completely falls apart.
Let's move on to Section 3, Commercial Insurance Dominance.
50 years. Over the past half-century, commercial insurance companies have seen massive, unparalleled growth. They've really evolved into these central driving gears of the entire healthcare industry. Honestly, you simply cannot work in medical billing without a really deep understanding of commercial payers, because they handle the vast majority of insurance claims in the country.
Commercial payers manage the vast bulk of group health plans that employers provide for their eligible workers. Basically, if you get health insurance through your job, you are almost certainly dealing with a commercial payer. Because their footprint is just so huge, you need to get familiar with these carriers right away so you're prepared for the daily encounters you're going to face with them in the workplace.
But, it's also vital to understand the flip side of this dominance. Because commercial insurance companies have become the main cogs in the industry, uninsured patients are put in a highly vulnerable financial position. Navigating a system that's literally built for massive commercial payers makes it incredibly difficult for an uninsured individual to secure affordable medical care on their own. Bringing us to Section 4, defining commercial carriers.
This requires a bit of a cognitive leap for a lot of billing professionals. You absolutely must strictly differentiate between two very distinct roles. On one hand, you have the commercial insurance carrier. That is a specific firm that actually cuts the payment check to the provider. But on the other hand, you have the network or the TPA. The carrier writing the check isn't always the entity that determines the actual monetary value of that claim. Some carriers participate in payer networks, and it's the network setting those costs.
And this ties directly into the role of third-party administrators. Commercial carriers rely heavily on payer networks and TPAs to accurately price and adjudicate claims behind the scenes. Think of a network as an intermediary, kind of an agent acting on behalf of the commercial payers. So if a claim is mispriced, you might actually have to take that up with the TPA, not the carrier who sent you the check. It's a huge distinction when claims don't process as planned.
All right, finally, Section 5, Summary and Next Steps. To wrap this up, whenever you're a medical coder or biller looking at a new chart, I want you to always remember these three foundational steps. Step 1, categorize the payer. Is it commercial, government, or a TPA? Step 2, follow the universal mandate. Every single interaction has to be filed as a claim, no exceptions. And Step 3, always distinguish the paying carrier cutting the check from the pricing network setting the cost, because they are very often not the same entity.
This foundational understanding perfectly sets the stage for our next explainer,
We're going to dive into the fascinating world of managed care models, compare PPOs versus HMOs, and see how this whole system functions financially.
So I'll leave you with a quick thought before part 2. How do managed care plan models like PPOs and HMOs actually control access to care through primary care physician gatekeepers? Think about that for our next session. Until next time, like, share, subscribe to Decode Healthcare with Harshal.